Hello Ismail, welcome to India.
Hiya.
Thank you for choosing us from across the globe from UK. So as I can see, you have done already one transplant and you got appreciable amount of growth, and you came for a second transplant to add some density in that area. Am I right?
Yeah, that's correct. Previously, I had my transplant done in Istanbul, Turkey. However, after just few months, I wasn't happy with the results. I knew straight away one side of my hair, this side, was very fluffy from before. It was very wavy. This side was smooth and this side was wavy. And after a few years, it became very transparent, especially in the sun. And then after only coming here, I realized that it was because they had spaced the grafts out, and also they had put doubles at the front and triples in a few areas as well. I initially over there I put 1500 grafts and I put 1500 here, and I'm very happy for the procedure that you've done here, because in comparison to both, what was done there and the amount of time spent there was 3 hours. I joked about it with my friend as well. It was like when they bring in a herd of sheep and it's just about getting the wool off and getting the next one in. Whereas here, it was just amazing. The whole experience was.
So we do only one procedure in one OT in a day. Okay, we don't do it back to back. That is one thing. The other thing I want you to know is that hair transplant gives you hair which might become curly and wavy over time. So that can happen with us also, because in the end the transplanted hair are put at a density lesser than the natural hair. So they don't support each other that much and they tend to become wavy and curly. But yes, doubles and triples in the hairline will add to the unnatural look, and we put a lot of singles over there, and that should probably take care of the unnatural look of the hairline. Density also we have added quite a lot, and so your curliness, frizziness should come down, but let me tell you, it won't be cured completely. Okay. The third thing is you should focus on your lifestyle, take a high protein diet and medication like finasteride to retain the existing hair, because without that support there is a chance that the transplanted hair may thin out in future. So we should try to avoid that.
Yeah, so even here, it's my second day, I'm already walking around. Whereas, however, when I was there last time, it was cut in a way, whereas my head was really heavy as well. Even the injections they put at the head front to numb your head, they just did it in the beginning, and I think they put it at such an amount, so it was for the whole duration. So it lasted, even the next day my head was numb and it was like a balloon. And after 2 days here, it's like I've not even had the procedure. I woke up over there with a bloody pillow. It was blood everywhere, and here I was just surprised. So in my head, I thought I was going to go through that whole procedure again. However, coming here and having it done, it's just been amazing. And I was just telling my cousin who I brought with me that you're very lucky that you got your first procedure here, because you've saved a lot of time, a lot of grafts. I mean, I wish I came here for the first time.
Yeah. So over the years in Eugenix, we have improved our skills in terms of the local anesthesia. We inject less, only that much is required, and people are not encountering swelling at all. 10 years ago, yes, our patients also used to have swelling of the forehead, and gradually we have improved our technique to reduce the chances of post-op swelling, which are almost nearly zero at Eugenix right now. Secondly, the punch that we use for extraction is a very sharp, fine punch, which leads to a rapid healing. Okay, the punch is thin walled, so the size of wound is less, but still we end up getting a good chubby healthy graft. So we are using those kind of punches to accelerate the healing at the back, and the overall post-op recovery has improved at Eugenix over the last few years, what I am observing. That is due to improvement in expertise, technique, and more experience.
Yeah. Also, I'd like to say a big thank you to the team as well. They were just so helpful and very polite. I felt like a celebrity here. I mean, they're telling me say this. I was like, nah, just call me Ismail. I'm just a normal guy, but I felt like I was royalty here. Honest, it was just a great experience. Also, the time that I came in, the welcoming, and you could tell everything was in place. There was step-by-step procedure. Again, I'm comparing into before. I was there, same amount of grafts, 1500. I was there done in 3 hours.
Yeah.
They didn't even check like you lot did over here on my forearms to see if I have any reactions. Allergy testing. They did none of that. It was just get inside, do the line, check your plasma, and then straight into the procedure. And it was just getting the grafts out and putting them in. It was only one person, but here there was like 6-7 in a room.
Yes. So our rate of procedure, like what we call the speed of procedure, is much lesser than other clinics because we do it in a non-hurried manner. Okay, so we are not in a hurry to finish the procedure, and usually 1,000 or 1,500 grafts case also ends up taking a lot of time. And yes, the manpower we have for one particular OT is also high, so that nobody gets tired at the end of the day. The procedure is done in a slow manner rather than a hurried manner, so that our main focus is to achieve survival of the implanted grafts, because that's what going to stay for a long term. And aim is to be in touch with you post procedure also, so that we can provide you support in terms of advice.
Yeah.
What diet to follow, what care to be taken in case you get folliculitis or dandruff, and then continue your medications like finasterides and multivitamins to maintain your existing health. So that's our main focus.
Yeah, even I just got a message today in the morning, like today's your day 2 procedure of following the procedure. Today you will experience this, the oozing must have settled, etc. Or what to do, the links. I mean, so it's not that you've had the patient, you've completed the treatment and then it's goodbye, and not you follow up. And so far I'm just so happy. And I was just speaking to one of your colleagues. I was like, who is this Golu? He's messaging me. He never even seen me. He's in Mumbai, but he's sending me all this information. It's very helpful.
Separate team which take care of your pig drop, because doctors can't be involved in that. So we are actually trying to improve the process, and we are still way ahead of where we are now to improve your overall experience. So now my target is, like, once you've gone home, we should not be losing touch, and we should be providing you support in every possible way.
Yeah, I appreciate that.
Thank you.
Thank you as well.